So our next speaker today is Dr. Alix Darden. She is a professor in the Department of Pediatrics at Oklahoma University Health Science Center, and she's going to be giving us several talks today. The first one is going to be on CVs, portfolios, documentation.
Thank you. I always enjoy doing this, and I love working with faculty to help them do the thing you have the least amount of time, but maybe one of the most important things to do, which is to pay attention to your career and collect information about it, in addition to what Dr. Geraci said about planning the career. So mine is the next step in the road, down the road. I have no relevant disclosures. I wish I did. So hopefully at the end of this, you'll understand, you'll have some models and a systematic way to approach collecting and documenting your data, and also have an idea of what you should be collecting and why you should be using that particular data. So there is a difference between a curriculum vitae, a CV, and a portfolio. The first thing I want to say to you is know what your school or institution wants you to be turning in for promotion. You could spend tons of time putting together an educator portfolio, and your institution says, all we want is a CV for you. Now, I'm not going to say that educational portfolio was useless, because I think it's actually extremely useful. But be very aware of what you need to be doing and how you need to be collecting it. So in the get-go, at the beginning, you're using the format that you're going to use 5 or 6 years from now. It'll just make your life a whole lot easier. So a CV is really your grocery list of what you've done with your career. What you do is what you have done. And again, this is mostly quantity, but we'll talk about a little bit of a quality, but I consider this a grocery list or laundry list, basically. The educator portfolio, on the other hand, can provide evidence of excellence. And this can become useful at my institution. We've gotten a new CV format, which actually is a combination of both a portfolio and a CV, but the other thing is we have to write a narrative. So people have to write a teaching philosophy. So the combination, the CV has boxes in it now for education where you can actually put outcomes in it. So it's kind of a mixture between a CV and a portfolio, but people have to write a narrative where they talk about their educational work, their scholarship work, and their service. And so you need to be collecting information in some levels for both of these. But I can't emphasize enough, know what you need at your institution and keep up with it, because it may change. Just like the LCME and the ACGME, in academic medicine, things change at the flip of a coin. You get a new dean, oh, I want to do it differently. So what is a portfolio? And this actually comes from, this is a dictionary definition, this is a collection of best works. So your portfolio likely does not list absolutely everything you've ever done, whereas your CV may. And in the beginning, you probably have a lot more what I would call low bar things. As you get more advanced, you may say, oh, I don't really need to put that stuff in, but you collect it at the very beginning. I always recommend that you collect almost everything, because you never know when you're going to need it. Dr. Geraci talked about shifts in your career where you decide you want to be over here and you've been doing this. Well, maybe you decided you want to be over here because you dabbled and you did some things. Well, if you just sort of say, well, I was having fun over there, I didn't know I was supposed to record it. When you tell someone you want to shift your career, they say, well, where's the evidence that you're ready? Right? It's all about, used to write grants, trained as a bench scientist. Everything's about preliminary data. You get things because you have preliminary data that someone agrees that you are now worth investing in. We are willing to invest in you to promote you. We are willing to invest in you to give you a leadership position. We are willing to invest in you to give you a new role, to give you a grant. So if you think of yourself as an investment opportunity and not self-promotion, many faculty say, oh, I just can't self-promote myself. It feels like I'm just self-promoting. It's not. You are an investment opportunity. And if you think like that, I think that you'll have, that sort of dissociates it from self-promotion to, my institution needs to invest in good people and I want to be one of those good people. So that's another thing you need to get about it. It really isn't all about you, because it's about the institution, it's about the students, but you may be the person who's uniquely able, and if you don't help people understand that, they'll never know that, and then your students will lose out because of that, and that would be a shame. The other thing that's very important for both the CV and as well for the educational portfolio is that this is systematic. And this is something Dr. Geraci also talked about. Have a systematic plan. Have a systematic format for collecting your data, a systematic way for doing it. So this is a representation of a systematic approach to education, and this comes out of a publication I'll show in a moment. But often we say, oh, I've been told to teach a class in the medical school. I have to do this with the residents. I just show up and they're all there. But the reality is that probably at some point somebody, whether systematically or just sort of in the middle of their sleep and they woke up in the morning, went through all of these steps. What is the problem? Why are we teaching this subject? Where else is it in the curriculum? Does it need to be someplace in the curriculum? I apologize for the white lettering. It doesn't seem to be showing up very well. Then if you're going to do something, you need to develop the goals so you actually achieve what you're being asked to do to solve that problem. You want to apply the right educational strategies. Is this done by a didactic course? Is this best done by a workshop? If we're teaching someone how to be doing an academy, we probably don't tell them to read the textbook. So what is the right tool to be getting to this educational goal? Then you implement it and you collect data about it. Now this will also apply, this is not just teaching. This is mentoring. This is curriculum development. This is curricular assessment. Each one of those is a separate tool. If you develop a curriculum for your residents and you teach in it, it doesn't belong just in a line item that you teach something. You have developed a curriculum. You have actually taught parts of it, so that goes under teaching. If you used evidence-based development, and I'll talk more about this in the educational scholarship talk, you may be able to turn this into a scholarly project because you've already done some groundwork related to that. Your residency director likely needs to evaluate, was this effective? Otherwise, it's got to go out the window because we have way too many things. So you're assessing it, so that better go someplace on your CV that you did an assessment and you actually had an outcome that, yes, this was effective. Otherwise, you lose that part of the work that you're doing. So educational activities are often extremely complex. And if you want to get credit for all the parts of it, you have to really granulate it down to a much lower level. I would highly recommend that you get a copy of this particular publication that came out of the AAMC. I think it was around 2007. Yeah, 2007. And this is where they actually talk about dividing up the scholarly approach and the components of being an educator, dividing it into teaching, learning assessment, mentoring and advising, a different skill set and different activities from teaching, curriculum development, a different skill set and different activities than walking into a classroom and giving a one-off lecture. If you develop something for the rotation that you do on the wards, that's curriculum development. The content that you deliver is then the actual teaching process. When you assess if the learners have gotten it and understood and evaluate them, that's assessing. If you have a student or a trainee that's at risk and you then mentor them and get them up to speed, that's now mentoring. That's 5 different activities. On something you said, oh, I was just attending that week. Got it? Okay, so really be thoughtful about this. And then if you do turn it into educational, this can then become educational leadership or administration when you get those leadership and administration roles because you were so effective at the other things that you documented so well. You probably might also get good teaching evaluations in the process because you're paying attention in a thoughtful, systematic way. So if you're thinking promotion, and this also comes out of that same article by Deb Simpson in 2007. When I work with faculty, we often think quantity. I have 500 patients passing through. I collected so many dollars. I have 5 first author publications. I've taught so many lectures. Quantity is only one part of it. Quality is another huge part. So-and-so over there, faculty X, mentors / advisors 30 students a year, 30 residents a year. And Z over here only does 5. Wow. Faculty member X wins because they've got the high quantity. But when you look at the quality, first faculty member met with those residents once a year, said, how's it going? Do you need any help? Thanks, I'm glad you're doing well. Maybe you should, I'll approve your ILP. Faculty member Z mentored these residents in research. They got one local presentation, they came to SRM and presented, and then one of them is in the process of writing a manuscript. I would say that's a very different quality level. So you wouldn't see that if you just had the laundry list written down of the quantity. So it's important that in some mechanism you track quality. And if whatever your institution has you collecting your data in doesn't allow you to do that, ensure yourself that you have that someplace. And on the end, I have slides that have resources for educational portfolios. You can do it on your computer in file folders. Always assess the outcomes, because outcomes is really a quality measure. So that's why this particular model is called Q squared. That's quality and quantity. And the third part of that is engagement. Engagement means engaging with colleagues in the process of doing this. So maybe you're on the curriculum committee. We don't do anything in solo. Maybe you come here and after working on a curriculum with some colleagues to put something together, say, this is kind of cool. I have a systematic process. I've worked with my faculty educators here and they seem to really get it. I think I'm going to do a workshop at SRM on this. You're now engaging. You've engaged your local faculty. You go regionally and engage them. Maybe it becomes a MedEd portal resource. Okay, so that's the Q squared plus E. Engagement is very important just because everybody wants to be able to do things faster and more smarter. And if you have a method, they're going to be thrilled to hear about that. So one other part of this is down here at the bottom where we talk about the scholarly approach to educational activity, and this will become important when we talk about if you want to do educational research. Here means you need to be understanding what's actually already out there so you're not reinventing the wheel. And so you know if you're doing something innovative that your colleagues want to know about, you draw on the existing literature. If you move to educational scholarship, you're actually contributing back to the educational literature. So that's the difference between being a scholarly educator and an educator who's doing the scholarship of education or the scholarship of teaching. Both are very important, and we'll look at some other things related to them. So I want you to do a quick inventory for you of what teaching, and you can pick one of them. If you want to do your mentoring, if you want to just do teaching, activities have you participated in this year? Just quickly jot some things down. Okay, so I want everyone to find a buddy. If you can group in 3s or 4s, that's always handy, because you're now going to learn from your colleagues. Share what you do, make sure you both talk, and then see if maybe they're doing something and say, oh, I didn't think of that. I do that too. Okay, so now let's see if you can learn from each other by sharing. Okay, I hate to break this up, and I know you haven't made it very far, but I've already given you 3 minutes. And I only have 30. So you might need the break to keep going, but you can stay in your groups. If this first group can tell me one type of teaching activity. Okay, so advising programs and mentoring programs that people participate in. How about the next row back? Okay, so you see the nuances. Lecture, classrooms, clinical, back group, one thing. Okay, so simulation. So there might be large group, small group, mentoring, assessing, lots of stuff going on as sim curriculum development, back group. Okay, so now we have lecture, case-based. And case-based in ethics versus maybe case-based in some other area. Simulation might be some more hands-on training, can also be case-based. Front group here. Okay, observation. So, I mean, there are many things in there. I'm trying to grab some new words, because also when you write these down in your CV, sometimes you have to be succinct. And this could be an example of how we'll sort of fill this table across as we go, but of how we're going to talk about, here's you would list what is just a pure description. And that might just be on your CV as these are your teaching activities, and you might have to expand quantity or quality in some other place if your CV does not allow that. You might want to talk about precept for feedback that you provide. That takes a lot of time, doesn't it? And then here you can also think of the quantity of this. How many often do you do it? Once a year? How many hours a week? Is this a weekly thing? You know, you got the idea. All of that could deal with the amount of quantity you do. What is your role? Are you a lecturer? Are you a facilitator? All of those kinds of, did you develop the curriculum, develop the workshop? Did you develop instructional materials to go with that? That may go in yet a different place, but you say, oh, I was just teaching some cases. Did you write the cases, right? So all of that goes into it. I recommend, if you have control, that you use tables to deliver this kind of information on your CV. You may or may not have control. This is more of an example of what might be in an educator portfolio, and each item would just be one line. I've put a lot of information, but you would have one line. I was working with the medical students. Then you'd say how often you meet, how many times a year, how many medical students, what your role is, etc., until you got to the next line of the table. Now go back to those groups. How do you measure the teaching quality? Just talk about what you do. How do you know it's good? Because you're there? Because the school hired you? Evaluations? What else? Awards? How do you think you get the award? The evaluations, it might come from that. So the award might be a secondary effect, but certainly quality, part of your quality can be awards if they're given to you by the trainees themselves. Excellent. ITE exams, trainee pass rates, larger scale exams, national exams. So you may get feedback from the mentee, but you also get the abstract got accepted here. They successfully put together a poster, and a lot of times they did it locally. First, maybe you have a research meeting at your home institution, then you take it to the next level, then it shows up at PAS, then finally it becomes a manuscript, so you're building, and all of that is part of the outcomes. Did they get into a fellowship? Did the resident find a private practice? If you had a fellow resident, if you tracked them over 10 years, did they become a department chair? So some of the things you aim for, as a mentor, I might take credit for a role in a lot of that, depending on what you played. But if you're working with more upper level trainees, fellows, or junior faculty, where did they end up? If you're in the research area, did your mentees get grants and things like that? So really think big. So learner evaluations, peer evaluations. I go in and observe faculty teaching as part of my role. You can ask a colleague to do that, see what they write. Measure of learning, formal assessment, informal, anecdotal. Anytime somebody writes you something that compliments and says thank you, a patient writes it on a little card, you get an email, save it. That is qualitative data. That is data that reflects the quality of your work. It is one piece of data. It is not the piece that's going to get you promotion, but if you have lots of patient comments, if you have lots of student comments that are positive, and never put the negative ones in, you get to pick this, right? But you can put the negative ones in if you want to demonstrate growth over time. If you want to say, I paid attention to my students in year 1 or 2, they were saying this, it's a risky place, people feel scared. But I think I know the promotion committee, and then you say, and 3 years later, these are the comments I'm getting. That's powerful. You changed. That's what you want your learners to do. That's what we want our faculty to do. You developed. But we don't know it if you don't tell us. And you will never remember it 5 years from now if you don't document. Scan those thank yous in. I have a folder, it's called commendations for each year. So I can go back and pick through should I ever need them. And if not, on a really lousy day, I love going back and reading them. Okay, other outcomes can be presentations, program accreditation, if you're a program director, right? So got to start really thinking big. Anything that reflects the quality of the work that you do, or is a mirror that reflects back on you. And one way you can do it is, you can think about this, is when things go bad, you know really fast, right? So think about the flip side when something goes bad and someone complains, or you're called into your supervisor's office and say, if that was really good, what would that look like? I need to write the good part of it down, because I wasn't. They often will say thank you for good stuff, but sometimes they don't know because nobody tells them. So you need to help promote yourself that way. One way to think about assessing learners, how many of you have ever seen Miller's Triangle? Okay, so you can look it up. This is a publication, but it's a way of thinking about how do you assess your learners. Are you assessing them at the lowest level? They know. So that could be a multiple choice test. You're just asking simple questions. They know how. So again, this shows case presentations. This can be very effective when you talk about your teaching. I am teaching them to think at a higher level. We just heard about teaching cognitive thinking for doing patient diagnosis. You need to think that way maybe about your teaching as well. So what evidence do you have that you're taking them above just plain medical information? Shows how. This would be the simulation stuff. Sim is usually very, very effective at showing that they can actually show how to do stuff. OSCEs, things like that. And then does, I often say to faculty who are working on research projects, can you read the student notes? Can we do a qualitative analysis of the student notes? I loved the idea of doing think-alouds. If you got permission, you could record the think-alouds and come back and do a qualitative analysis of think-aloud to even demonstrate how your trainees are changing their thinking over time. So this is just one model of doing this. We're going to skip this because I've been waxing way too eloquent, but this is something to do, to think about the list that you've created and think about what quality evidence do you have. And then this is how you might record it. What learner evaluations, which means you have to have this data. Don't count on MedHub having it for you 5 years from now. Collect it every year. If you don't know where the medical student evaluations are, ask somebody and collect them, get them. If you're going to do a workshop someplace like this, bring your own evaluations. I'm already a full professor. I don't necessarily need these, but if I felt like I did, I would have evaluations and I'd get penned out and I'd collect them back and I'd go ahead and collate them home. So be proactive. If there are not evaluations available for you to get, create your own. They're not that difficult. This has all kinds of examples: pre-test, post-test, pre-assessment, post-assessment, peer review. If they have peers reporting back about each other, that potentially could be used. So why do you want to assess your educational activities? Annual reviews. So the good way to keep up with this is every year make sure you got it all. So when you go into whoever's reviewing you, they're very clear what you're doing. I now have a new chairman, and he didn't hire me, and my job is kind of nebulous. And he says, I really just don't understand what you do, Alex. So this year I made sure I made it extremely clear, and he said, I didn't know that. So I think he now has a much better idea of what it is and I do and how I'm helping his faculty, which is his interest. Nobody knows what you do like you do, and honestly, nobody cares about it the way you do. Anybody who's above you is caring about money, flow of patients, keeping things on time. They care, but they don't care so much about what you do with your individual minutes. So you have to help people understand. Think of it as educating people. You are a valuable resource. It costs money to get you to come. It costs money to replace you if you leave. So you have to help people. We'll talk about in the next talk I give after the break about how these can turn into publication opportunities, leadership opportunities, negotiation of job duties, how to say no. I'm doing all of these things. Maybe you didn't realize how long it takes that I created these cases. I'm working on them to put into MedEd portal. So keeping good documentation of what you do can be useful. Awards. So somebody might say, I want to nominate you for a national award, a local award. I need some data from you. So this is just to remember that it's quality squared plus engagement. You kind of need to keep track of all parts of this. Each one goes someplace else in your CV. And again, the engagement part is going to be things you're going to be doing at workshops outside your department. So if you give a talk for grand rounds in your department, it probably goes someplace under continuing education. If you give the identical grand rounds in Arkansas, and you're not from Arkansas, and somebody invited you to do that, that's invited presentation. It speaks to your reputation, which Dr. Geraci said is very important, and in our CV it goes under scholarly work. If you do it in our campus in the Department of Pediatrics, that's being a good citizen. It's what you're supposed to do. Same content. Okay, does that make sense about how you think about some things differently, depending on what you're doing and where you're doing it? So this is interesting because in education, in teaching and learning, Scholarly work may not be just peer-reviewed journal articles the way it might be in many other disciplines. Peer review can mean many things. And some of this is low bar, so you need to have peer-reviewed journal articles. I'm not saying you don't. But other things can count as peer review. So if you develop a curriculum that's been now adopted by 4 of the other major medical schools, was that curriculum reviewed by peers before they adopted it? Yeah. These are other major medical schools. Do they have a reputation at stake? Yeah. You'll probably get some letters from them, or you can ask for them thank you. So that's something you can include, and then I would say take it the next step further and try to publish that in MedEd portal, but maybe you then publish it with people from those institutions, making your job so much easier. Okay, so that is a level of peer review. So again, think outside the box a little bit. Another thing that's coming up is, do we count social media posts as part of promotion and tenure? So this is an article from JGME, Journal of Graduate Medical Education, and there's a couple of others out there. I have skimmed through this article. I'm not yet convinced, but I'm not on the P&T committee. I would say at this point, doing something like saying, oh, my social media stuff's got 5,000 people following me, and I'd say, oh, President Trump has 5,000 people following him. Is that evidence-based? Is that peer-reviewed? So I think you need to look at what is the quality and what is the impact of the work that you're doing with social media, and does your campus value it, and what evidence do they want to see? Particularly in this day and age of fake news, shallow reporting, things like that. So I just put this out there because if you are someone who's heavily engaged in this, I would encourage you to pursue it and see how can you attach quality to it, so this kind of work could or might be considered. But this is a brave new world. Could be, who knows what's coming in this area. So here's the $1,000 million question, right? How do I keep track of all this stuff? I am so darn busy. This is how I do it. How many of you use Outlook? Okay, a fair number of you do. So here is Outlook, and I just took a screenshot, and over here is a section called Categorize. How many of you categorize things? Okay, so some of you do. So it's up there, it's a nice and colorful bar, and if I click on it, it makes a drop-down menu, and you can't see it, but these are all my categories. So I have things like I'm involved in the Educational Scholars Program at the national level. I have talks that I give locally. I do mentoring. I do CV talks. I do a wide variety of things. So what you need to do is color code the activities that you do. So when you teach medical students, maybe your color for teaching is red. And every time you put in any kind of teaching activity, wards, whatever, you color it red. So then you can come back 4 months later, and I can do, here's my colorful calendar, and you can even see, where is it, does it say it? Sometimes I'll say something about, I'll give myself an hour to work. Here I am writing up somebody's teaching evaluation. Sometimes I'll say work on a particular presentation. I put in my scholarship time. I don't really get any, but I put some of that in, work on a presentation someplace. So if I put in the name of one of my categories, let's say the Educational Scholars I think I put in academic coaching. And I do a search on that. This is what my search comes up looking like. And it looks for academic coaching all over my calendar. But if I now sort based on the categories column, which is over here, you can see that there are many things that come up that the word academic or coaching doesn't appear in the title. Right? So now I could say, oh, this is the amount of time I spend on academic coaching, and these are the kinds of things I've done. So if you did that one for teaching, one for research, one for scholarship, you figure it out, right? But this is how you do it. I thought I'd give the screenshots because sometimes, there's just way too many buttons to push. So what I'd like you to do is, and I have a slide that has different educator portfolios. First and foremost should be find out what your promotion requires for documentation. Find an educator portfolio format that you like. Fill it in where you can, keep up with it. It may be 2 documents, one's your CV, one's your educational portfolio. It could be a folder where you just dump a whole bunch of stuff. Use this to help you develop and create your plan. Keep it current. right? Some people update their CV every time something happens, especially big things. For educational portfolio, maybe once a month you want to have a color on your calendar that says update educational portfolio for past month. So here are some educator portfolios that are in MedEd portal. The one I really recommend is the top one, but and then there's some publications associated with that as well. But these are pretty easy to find if you just search MedEd portal for educator portfolio. So these are my conclusions. You probably have your own. Often might say, so what are your conclusions from my talk? I'd love to hear what you think. But educational scholarship is recognized and defined for academic advancement. It may or may not be only peer-reviewed publications. Grants are very difficult in education, so it's highly unlikely that it's going to be grants. We could have another whole talk on getting funding. Remember, your CV is just a list. This is your laundry list of what you've done. The portfolio gives you details, quality, quantity, engagement, what's happened because of that. And it's up to you. Only you can keep track of your data. So thank you very much. I think that I do have a couple of minutes. Oh no, I ran over. Sorry.